Good evening and warm greetings on this International Women's Day. I and Dr. Neha are your hosts for this evening. I'm Dr. Himadri. I'm a dentist and a public health professional, and Dr. Neha is a dentist and is passionate about public health. We both lead various initiatives at Health Parliament and Digital Health Academy. So today, at Health Parliament, we are celebrating the women leaders for their contributions. These women leaders have created an everlasting impact through their journalism and media. Each one of you represents the voice of a few crores. So it's a huge responsibility, and we are honored to celebrate and acknowledge your contribution. Throughout, you all have been interviewing people. Today, we have this opportunity to interview you. And I must confess, I'm excited and nervous at the same time as we are going to interview the bigwigs in health journalism today. We would like to know the people behind these insightful writings that we read every day, and we would like to know your journey in the space of journalism. We would like to know what it takes to become a successful journalist and what are the things that you have seen personally that you don't write about and how you have shaped the thought leadership in the industry. Journalism has always been a male bastion. We would want to know how was your journey to the top against all the odds. So here once again I would welcome you all on International Women's Day. Having said all this, I would now move to our first panelist, Ms. Viveka Roy Chaudhary. She is the editor at Express Pharma, Express Healthcare and Indian Express. Ma'am, you are a journalist with close to 2 decades of experience in the pharma and healthcare field, and you're managing top two media publications simultaneously. So it would have been a great transition for you to start from an in-house journal and move to one of the most respected brands. So ma'am, how was your journey like? What motivated you to take this as a career?
Thank you, Himadri, and thank you also Health Parliament and Professor Rajendra Pratap Gupta for conceptualizing such an event and for giving us women journalists our place in the sun, at least for today. So yes, it was a transition from taking care of an in-house magazine and then moving on to a mainline publication. But that doesn't really tell the full story because I moved from an in-house journal of a pharmaceutical company. I was completing my evening course. In the times that I did it, there were no full-time courses for journalism. It was an evening course. And I chose to join that pharmaceutical company to handle their in-house journal because at that point of time, they were launching an anti-AIDS medicine. And no points for guessing which pharma company that was. It was Cipla. So I did my evening course in journalism while I was handling their in-house journal. And by the time I completed my, the journalism course, Financial Express was starting out, and the Indian Express Group was starting out the slew of publications for the pharmaceutical, for different sectors within industry, and pharmaceutical was one of them. So that was 1994. And I joined Financial Express at that point of time when we launched Express Pharma Pulse. And we launched Express Pharma Pulse in December 1994. And by Feb 1995, I had to take leave of absence because I was going to have my second baby. As I always said, my first baby was Express Pharma, and my second baby was my son, who was born a little bit later during that year. So I took a baby break. And that baby break, for various reasons, my husband got a transfer, etc., etc. That baby break stretched from 2 years to 5 years to 7 years. So when I came back to journalism, it was in 2005, sorry, and the whole world had changed. There was no internet when I left, and suddenly the internet came in. There was no desktop publishing. We used to, flow everything down by manually with typeset, etc., in 1994, 1995. So the transition actually was not just from a house journal to a newspaper, but also from the whole era of typesetting of a newspaper into the digital age in 2005 when I rejoined. And then it was a question of learning from my team members, a question of picking up from youngsters so while I understood the farmer beat, and lucky for me, in my break, I also kind of did a lot of freelance writing, copywriting for pharmaceutical companies, because we were based out of Ahmedabad. So there were a lot of, and Ahmedabad is like the pharma hub of India. So a lot of pharma companies, etc. So I got to write, do copy for them, revamp their websites, etc., etc. So was able to kind of keep in touch with what's happening in the pharmaceutical industry. So yes, when I came back, there was this whole new worldwide net and web that I could, tap into for information, for sources, and the whole physical thing of going and actually meeting your sources. You go prepared, etc. So all that was not there in 1994, 1995. But in 2005, there was a lot of information that you could get online, and then you go prepared for your interviews. So that whole transition was there. And what helped me was the ecosystem that, of course, a supportive family. My son was then, big enough for me to leave at home and go back. And then, a supportive, office colleagues who helped me, who kind of, I was pitchforked into the so-called digital era of that age. And then a lot of people within industry who kind of helped me come up to speed with what was happening in the industry. And from that time onwards, I mean, it's been transition after transition. I think this industry, both the media industry as well as pharma industry, has been through some great transitions during this time. So I hope I've not overshot my time, but your question had a lot of layers to it.
Thank you so much, ma'am, for sharing your journey with us. With this, I would like to move to our next panelist, Ms. Rapali Mukherjee. She's the Senior Assistant Editor at Times of India. Ma'am, you had the rare honor to represent the people through the media and to represent the country. You also represented the government of India, and you were also awarded the prestigious Chevening Scholarship. In this long journey of working across continents and foreign publications, you have seen it all. So please share your inspiring journey in the field of journalism with us.
Yeah, hi, sorry. So thank you for the kind words and the introduction. Just giving you a brief snapshot of how I started. Um, so it was a desire to kind of contribute to society and bring in a change, which I grew up with. And that's the reason that I kind of picked up journalism as a career option. So I did a course in business journalism from the Times Center of Media Studies from Delhi. And thereafter, I started working with the Economic Times. And did some reports there in terms of the restructuring of public sector undertakings and stuff. I moved on to the Financial Express, and there I got a wider canvas to work on and some price beats. And I worked on a whole lot of sectors like retail, consumer goods, automobiles, and aviation. And here at this point, I also was awarded a scholarship by the Chevening Scholarship, which is the run by the UK Foreign and Commonwealth Office, which helped me hone my skills a lot. Thereon, I moved on to the Times of India, where I started writing on health and pharmaceuticals, which is a most critical area of the Human Development Index. And my writings now have looked at various aspects in terms of medicines, the quality, safety, the accessibility, pricing issues around them, and healthcare expenses are one of the largest out of pocket expenses. So I try to, and that's a key interest area for me, in terms of trying to bring out the challenges which people feel in terms of accessing treatments, then talking about shortages and stockouts. So I'll stop there. Just giving a brief snapshot of what I've been looking at over this period.
Thank you, ma'am. Now I would like to go to Sujata ma'am. So Miss Sujata Vishnuraj is the editor at Healthcare Radius. Ma'am, I would like to start with your photo of riding a bike. It definitely shows your mettle in terms of writing, which is known, as you know. This field is a male bastion. So is life as easy as writing or as tough as riding a bike in journalism as a woman? Please tell us about your ride rather than your journey, please.
My ride started not for the journalism, but to be a nuclear chemist. That was my intent, and I studied chemistry. To be very precise, I took a master's from Ruya College on physical chemistry, and onward when I was all prepared to do my PhD. I had to take a break because of some personal reasons, and during that time, I used to write for Science Reporter. If you all remember, there used to be a science journal in our time. So I used to write small stories for them, small reports for them. So my family told me, you write, so why don't you take a official or rather a professional qualification in journalism in the 1 year that break that you are taking. So I took it, and I landed up in a job as a copy editor for an architecture magazine. So, as a science student, architecture was something which was very alien to me. So, when I joined, I used to call facade. So, that was my level of understanding of architecture. And from there on, fortunately, the architecture magazine that I joined, Indian Architect and Builder, it taught me what professional journalism is, or how to write and how to dig up stories and how to do features. So I owe a lot of my writing capabilities to that magazine. Um, from there on, I served that magazine for almost a decade before I took a sabbatical, and then I decided to pursue my passion for riding. I started my first bike is a Thunderbird 500, so I learned with a heavy bike. So riding is easier, but life is not. So is writing. It's not easy. Um, Many may feel that when you see a higher cc bike, it may be very heavy and it's very difficult to ride, but once you get used to it, it's not. But life and your work, your profession, it always throws up some or the other surprises to you, which you have to find a way to kind of handle it. So I rejoined my profession back in 2011, and that time I went back to a journal which is catering to the chemical engineering side and the pharma side. I used to write for, I was the deputy editor for Pharma Bio World. uh, 1 year down the lane, I met with an accident, and then kind of I again had to take a break of around like 3 months, and then I I started working with the healthcare magazines. That's my journey in terms of writing. And yeah, writing and going after something which nobody looks at. For example, in healthcare, uh, most of the time, if you see my interview question, there will be a question on the rural and the primary healthcare centers, because I believe that because our most of our population is in the rural area, I believe that that is where our healthcare infrastructure should begin to look at, rather than the cities, because cities are flush with hospitals. You can run into any hospital at any point of time, but when it comes to the rural health, that is something which we need to look at. That is my focus. So every in Professor Gupta also might have had that question when I interviewed him. So that is my constant question to all the healthcare leaders. That's my journey as of now.
Thank you so much, ma'am, for sharing your journey with us. Now I'll move to our next panelist, Ms. Pratibha Raju. She is the Assistant Editor Digital Content at ET Healthward in the Economic Times Group. Ma'am, as we know, journalism is more about the connections that you have built over years. So, how in your early years you established yourself, because now you are a brand? So when you call people now, they don't probably even ask you which publication you're calling from. All of you are known by your first name. So, ma'am, how was your journey in your earlier years?
Thanks, Dr. Himadri. It's nice to be asked questions. We are all used to ask questions. Now you're asking us questions. Really nice. And it also, feels like how difficult it is to answer. We always question others. We're used to this. So I'm keeping it short. So I started my career as a cub reporter, covering various beats. Like I started as a crime reporter. Then I also did a little bit of civic bodies. I covered civic bodies. I was in Chennai. I basically worked in Express there, and then had to move here to Delhi. And I was in a media agency. I worked for INS. Then when the Nirbhaya case came in, we were covering it in and out. We were going in, and every day my second home would be Safdarjung and AIMS Trauma Center, and we used to go and cover it. And we'd be like giving us so much news, and I was like, talking to the doctors there, and the Safdarjung Hospital medical superintendent used to run away seeing me, because like you go there and ask them every half an hour if there what was the condition of Nirbhaya. And it was like that which I wanted to get into healthcare journalism, because I think I started from there. And slowly I started writing more on health and healthcare, and various segments on radiology, diagnostics, and everything. And one good thing was, like, when you write on healthcare, people, there's mail which comes in from the writers, someone who has read, and they ask you questions. They ask you more, like, what about this? Can you help me with the doctor's contact, because I have this issue, especially when you write something on cancer issues. So I started slowly like that. Then the major part of my career where I got into and wrote deep inside was Express Healthcare and Express Pharma. And I'm happy to be sharing the panel here with Miss Viveka. She's one of my mentor. I'm really happy for that. And being in Express Healthcare, now being in EG Health world, we are a B2B platform here, and we get more opportunity, like unlike the other newspaper people, because we are into B2B segment. We can write more deep insights. We can see through the prism of business and value creation. We see that side of that aspect as well. Like Ms. Sujata said here, and like Ms. Rapali said here, I would also like to ask questions more on the GDP. I have one question on GDP. Why always the GDP is so less, and what we can do? Nothing happens. That is one thing. GDP on healthcare and primary healthcare centers, and that is one important aspect which I would like to explore, and we used to write more about it. Of late, one thing which I'm concentrating more on, basically because of COVID, is on technology, on artificial intelligence, technology, and telemedicine. That is now become an interest point for me, like, how this can help. So I usually now focus on that, maybe explore more on it. That is what I'm doing right now. Thank you.
Thank you so much, ma'am. So now I'll move to Ms. Shimuna Kanwar. She is the assistant editor at the Times of India. Ma'am, you were the only journalist to get training for TB research methods and advanced TB diagnostics, and you have promoted public health through journalist pursuits and advocacy. Ma'am, you are a role model today, but we would like to know who was your role model, what inspired you to become a journalist, and how has your journey been?
Thank you for this invitation. It's not very easy, after hearing all the other esteemed panelists here. It's not very easy, and I can correlate my journey with the advertisement of Cadbury, where this lady 20 years back, she dances onto the field, and where a man hits a boundary. And when there is this advertisement again comes as a kind of, it's changed now. And there is a role reversal. So the women, she hits the boundary and the man dances. So I think that has been the change in my journey. You know, that was the time when I just started my career in journalism, and I was not cut out for journalism. I would say that I did my PhD in English literature, and I was about to go for my postdoc. But this just happened because I wanted to do something. You know, I had submitted my thesis, and I wanted to do something in the meantime. So I just came by default here, and as a feature writer, I was taken in the Times of India, and I was given various roles which I never knew. I mean, I was cut off from the world of reality. I was absolutely into books, and this changed my life. I knew what was the real world. I knew that the world outside the books was so different. And from a feature writer, somehow my bosses thought that I had a tendency to write towards health. In features also, I started writing about health, and they shifted after 6 months me from the feature writing to the hard news. And here I am covering stories on public health, covering stories on basically on public health. Uh, in fact, I would remember, one vivid memory which I have, and I can never forget. That's absolutely made a lasting impression in my mind. We have so many stories to tell, but it's just one thing which I would definitely share with all of you was there was a strike in one of the referral centers here, which I cover. That's PGIMER in Chandigarh. I'm based in Chandigarh. So there was a strike by the doctors. And so I had to go and I had to see the ground reality. I went to the emergency. That's my favorite place. So I go to the emergency often. So I went to the emergency, and there I saw that there was a lady, there was a couple, and she was pumping the ambu bag because it's very difficult to get ventilators. So, and she asked me, I didn't introduce myself, and she said, "Can you help me with this ambu bag?" I was reluctant because you have to be trained slightly. So I said, "I can buy medicines, I can do other things, but I can't help you in that." Anyways, we started interacting and we exchanged numbers. And I spoke to that person, the patient also, who was an ambu bag. And when I came back to file my story, I thought I should, call them and just take the status, what happened to the strike. And it was a shock. The person whom I had been speaking to in the morning, he was no more because the doctors were unable to tend to him. There was because of the strike. And the first thing which came to my mind, and I still regret that, was this is a front page lead and exclusive. And after a few seconds, I regretted. I regretted what I was saying, that here there was a man who died because there was no one to take care of him, and I'm shouting that this is page one lead. And that changed my life. So I thought that OPD patients, or these patients, are not just registered numbers. They are people like us. They come to the hospitals with a faith that there is a healer. And from there on, I thought I should work on public health, which touches people's life. So I think that, I just can go on and on, but this is what I would like to share. Thank you.
This was really inspiring, ma'am. Thank you so much. Now I would come back to Viveka, ma'am, for my next question. So, ma'am, what has been the most memorable moments in this whole journey till date that you feel you're going to remember always?
It's difficult actually, to choose one moment. But yes, the fact when we kind of started doing conferences, when we went from just being a publication into doing conferences, because a lot of times what would happen was that we write and we contact people for their quotes, and then of course do a lot of things over phone and over email, etc., etc. But the conferences and that we started off in 2017 really put us in touch with the people whom we were writing about, and we saw those people in a very different light. And possibly that was a moment of revelation for us. for me. And those were small moments like that that I could kind of I treasure them, because they are kind of not just milestones in the publication, but also milestones in my kind of evolution from just being a person who writes to also a person who talks. I would never have the confidence probably to speak in front of a whole crowd, in front of a hall, etc., etc. You actually feel the weight of what you're writing, what you're saying, when you see people, when you meet those people, when people come up to you and say things like, your story made a difference or something like that. And maybe because we are from the trade publication, we don't feel that. Maybe Rupali feels that quite a lot more, because she's in a mainline publication, so she feels that. But when we started doing it in 2017, that was a whole different kind of feeling. So that was one moment that and also the feeling of achievement, that okay, somebody's reading what I'm writing, all these people have come for the brand of Express Pharma, I'm part of that brand. So that was a nice feeling to have.
Thank you, ma'am. I'll now move to Rupali, ma'am. So, ma'am, what are the moments or instances that shaped you as a fine journalist, and what are the turning points for you in your journey?
I think during the years, in terms of while you're writing on a particular area, you do get for example, Shimona mentioned that you write, you go out to this thing, and basically an OPD, and you see what is happening. So for us, like I write on pharmaceuticals and healthcare, so I bring out the inequities which are there, the healthcare inequities. For example, recently, last 2 years has been all about COVID-19, and how this vaccine inequity has played out, how the drugs were not available, key key COVID-19 drugs like remdesivir was not available. So writing about them, and just putting out the shortages, the issues around them in terms of pricing, in terms of accessibility, and all of you know uh, that. So that is one thing which kind of plays on a person's when you're writing about stuff. Also, the impact which it would have on the reader. Like, you want to bring out facts as they are, not without any bias. Without any biases, and especially in an right now, you're facing this huge problem of fake news. So and it has actually aggravated this whole COVID-19 has actually aggravated this issue. So I think these are the things which kind of you have to keep in mind, not to sensationalize, um, bring out the facts as they are, and the true this thing without any biases, I would say.
Thank you, ma'am. Thank you. My next question is for Sujata, ma'am. So, ma'am, at Health Parliament, we conducted various research projects, and we were very surprised because the female respondents never crossed 15% of the total. So we dug deeper, and if we figured out, actually, it was maybe due to lack of inspiration that they had such low representation in these surveys and studies. So, ma'am, were there any reverse cakes or hiccups in your journey, and which are the moments that stand out when you look back that you would like to share with us?
Well, I never felt a bias when being a woman journalist. I was a journalist and I was treated as a journalist throughout my journey. So I personally has never felt that kind of a bias. So, well, but in work environments, I did come across few people who kind of lack the confidence in terms of when some kind of a task is given to them, they do have doubts whether they can go and get the story filed, or whether they can be done, and can such questions be asked, will they be answered. So those were things which I have seen throughout my journey, but I personally has never felt or come across uh, such an experience for myself. for me as a person, as a healthcare journalist, what stands out in my career is during the COVID time again. You connect with so many doctors and healthcare providers during your interactions, for your interviews, for your features and the stories, etc. Uh, During the first wave, when people did not know what they are encountering, as this virus was not uh, known completely, even to the scientific community. The In terms of the viral infections and in terms of the vaccine production, all of that. That is one thing which I think was very good when I look back in my journey, and the connect to all the doctors, which on a personal level could help many people at that point of time. That's something which stands out in during this 1 year.
Thank you, ma'am. So, Pratibha ma'am, like your journey spanning over 2 decades, and there would have been times that outshined, and there would have been times that were like a lot exciting in your career. So, ma'am, for you, what were the moments that stood out, and that you would like to share with us today?
Yeah, as other panelists said, there are a lot of moments where it is not easy to pick one or two and tell. But I would say that positive impact stories are, it always lives within you, like rather than any other ordinary news. So one news which I had. An article which I had written about the Bijapur, the Naxal affected area, where the particular district collector then, who had started in a gynecologic center hospital, was not there for tribal women. There was a lot of gap there, so he had started and he had appointed a lot of gynecologists. They had given salary to the doctors at par with the urban people, like urban doctors who were getting. So they started that, and that story still lives with me, like against all odds is the name of the story. And Dr. Ayash Tamboli was a district collector of Bijapur who started this initiative. So positive stories, right? Like there are a lot of negative stories, there are a lot of things which, like, I can't call it negative, like a lot of news which is like this is not happening, there's so much of gap and everything. We always talk about what is not there, but certain people do certain positive, they bring in positive impact in healthcare. So I think that also should be like focused upon and written about, so people read about it. So that was one story which had that was a good story which I always recollect. And we talk about the moments in COVID, during COVID times, right? A lot of people, since you're a healthcare journalist, a lot of people always, think that, you have resources and they call for beds or oxygen. And when you try to help them, right, that gives you satisfaction. They think that you can help them. So, I would like to mention here a lot of hospitals, a lot of people from AIMS and Safdarjung or any corporate hospitals, I would say, when I reached out to them, they helped a lot. A lot of people helped me. I don't know the person who's a patient who's sick or wants oxygen. I'll be just asked. People call us as a health journalist. They ask us help, and we try to do it. So that was one thing which happened during COVID times, which I think I was able to help somebody in some way. That was a good thing I could recollect right now. Yeah.
Thank you, ma'am. So, my next question is for Shimona, ma'am. So, ma'am, what are the most cherishable moments for you in your entire journey?
Yeah, so it's so difficult to just summarize, but recalling the old days now, it makes me look so old. But when I recall the old days, I remember that when I started covering health, they used to be mostly they used to be male journalists, and they used to give me call late night and say that there's a body missing from the mortuary and all those. So I used to have sleepless nights, and because I used to think that I might miss certain stories in the morning. So it was quite difficult, because it was very easy. It's very easy for men to cozy up to the lower staff, and they can make them sources, they can get things very easily. That's a challenge for a women journalist, I feel. uh, but then what happened is that I thought that, if I can't get these kind of stories, let me work on my strengths. So I started reading up. I started reading up more research-based stories, more study-oriented stories, which were people friendly. So I worked on that, and which was difficult, which was not easy for the other journalists to decode and simplify in language which people would understand. So, and I started attending those boring CMEs and those workshops, where I used to see the students themselves snoring and sleeping. But that required a lot of patience. And so this is how, I tried to change the equations. And so this I was followed up by so many other, and gradually, so what change I saw is gradually the male journalists, they started depleting. So there is no male journalist now in health, they're all females. So that's like that's like, our victory, I would say. That this is not against men. What I want to say is that we can't cast anyone in a stereotype. So I would like to, just clarify this. But it was like that you challenge us and we can reach those heights. So you challenge us more and we'll reach more. So this is a memory. I thought that, and other thing which was just mentioned, that it's been very touching moment when you help people. So especially during the COVID times, I think most of the health journalists, they have transformed from health journalists to people who can easily approach you and help. So that's like the change which I saw in most of the post COVID era. So yeah, that's it.
Thank you so much, ma'am. So this session so far has been really insightful and inspiring. So now I would hand it over to Dr. Neha for further questions. Neha, over to you.
Thank you, Himadri. Thank you so much, all the panelists. It's been so inspiring to hear your story and journey and the challenges that you all have faced. So going forward with the next question. So I would like to start with you, Ms. Viveka. Like, what, you are the voice of the industry. So what guides you and what is your source of strength?
My source of strength is actually like a responsibility that I feel that I have. And because people are reading what you're writing, and therefore you need to, like, contact the right kind of people to get inputs, make sure that you're not biased, etc., etc. And as something that Shimona actually said, really struck, the same way that she had she met that patient and the patient passed away. And it struck me that I had a similar kind of moment in my life where um, my son's tuition teacher's son, he passed away because of MDR TB. And it was at the time that he had MDR TB, he topped the 12th standard, and he was all set to go to IIT Mumbai, etc., etc. And at the same time, my son was doing his 10th standard, and they used to study together, because when my son went to to his tuition teacher's house, they would both be studying together. And when we realized 2 months later that he had passed away because of MDR TB, and I said, but that's such a family where you would never, and I'm talking about 2015, okay, and you would never expect that TB would strike in such a house. It was like, people like us, etc., etc. So I said, if I, as a healthcare journalist, so-called healthcare journalist, still have these kind of biases in my mind, it's time to kind of create more awareness about this. It's happening to all of us. And I had written similar stories about HIV a decade earlier, 2 decades earlier. So the stigma and biases that affect certain diseases, and the way that, for instance, that family never expected and never tested that child for TB, and that is why it went into MDR TB. So I wrote, I covered TB very slowly, very closely for that year. And then I still cover TB very closely because of that. Another disease that I find has the same kind of bias is leprosy. And leprosy is making a comeback in India very silently, but we've not heard about those stories as yet. And there are these kind of and it's our responsibility as journalists to pick up these stories and kind of shed light on them. So to your question about whom do I look up to, I look up to people who approach us with these difficult stories to do, with these kind of stories that may seem way out there, but we really should be covering. And I look up to other journalists who are writing about these things, other people who are writing books about these things. The whole quality fiasco in the Indian pharmaceutical industry, was it really manufactured properly, etc., etc. So we had a time in the pharmaceutical industry where we had two different sets of plants, two different manufacturing facilities, one for India and one for rest of the world, one for USFDA approved plants, etc., etc. Today, in the last decade, all that has changed. They have all understood that you need just one quality system, whether it's for India or whether it's for abroad. And I would say that that's because of the coverage that we have been giving, that we've been putting light on that. So I look up to people who have started doing these stories, and whom we can kind of follow in their path, etc., etc., hoping that it's taken forward and we take forward that torch. So those are the kind of people who inspire me.
Yeah, ma'am, thank you. So, Ms. Rapali, my next question is to you. So, you have had a phenomenal impact in the healthcare through your work. So, like, what was your source of energy that helped you create an impact on society across the regions?
My source of energy is bringing basically, I mean, for a journalist, it is all about creating awareness on a particular issue, bringing it to the forefront, and creating a discourse on it. And if there are, if there are gaps, let's say, in healthcare equity, or in regulation, so pointing them out, and so that corrective action can be taken. And that, I think, is a responsibility of a journalist. So you create the awareness, bring it to limelight, and probably, if it needs corrective action, then hoping that the government or the authority or the establishment takes corrective action, and asking tough questions around these issues as well.
Yeah, thank you. So, Ms. Pratibha, my next question is to you, ma'am. So, like, with your diverse skill set that you have, like ranging from research to writing, ideating concepts, and content development and all, you have moved masses with your work, right? So, what is the impact that you feel you have created in the society?
I don't know what is the impact I have created, because I'm still, have a lot more to do. That's what I think. I learned from many senior journalists who are here, and many others who are writing about pharma and healthcare. And also, I would like to say that health journalism is like, it's mostly, it influences the human health related behavior. So for me, first I have to be I have to do reporting, fact based reporting, and always see that whatever I'm writing, understand those complexities. Learn first learn whatever I'm writing, because this new virus is just hit us. No one knew what it is about. So when I'm writing about this, I have to go into detail, learn about it, interpret, know things, and factually be correct while I'm like writing it. That is one important thing I learned during the past 3 years. That one is there. And impact, I really don't know. When people come back to me and say this was really nice, and this had these details. One story which I did on ASHA workers and digitization, the ASHA workers were given everything. They were given tab, they were they had everything. These were from the rural districts of Odisha and everything, but they had no power to use a tab. There was no power, electricity there. When I went back and asked the National Health Mission director, this is the status, then they try, they had sent a letter saying, no, we will look on mail, saying that we will look on to this, and we will do our bit. So these kind of small things helps. you feel happy. This is what, again, bylines, when you write and many people come in and tell this is the impact, this is what has happened, then you feel the urge to write more. Yeah.
Right, ma'am. As rightly pointed that, the things on papers are different, but the ground realities are totally different. And that's where we need to pick the gaps, and you are there to fill those gaps, and, people work on those. So it's great to hear. So coming to you, Ms. Suchata, so like the same question I would like to ask to you as well as, what do you think you have had like the impact on the society from your
I
career?
Well, I don't know if I have had any impact, but what I try to do is to uh, provide information when it comes to healthcare, not just the ground reality, but also what the future holds for us and what are the research factors which are there. So I I give a lot of importance to the research factors that are going on, whether it is technology, whether it is in the pharma area or in the medical devices area. So mostly I concentrate on that, and I hope that I cover mostly from across the world, not just in India, what is happening in India, but from across the world, so that whoever is reading it knows what is happening in the world of healthcare and what can be done to cure many ailments that are there, and what kind of treatments that are available for each diseases. So that's what I try to do.
Thank you, ma'am. So well, you all are being actually very humble, saying that you don't know that you have had impact, but we know that you have left imprints on people's life. So on going forward with the same question to Miss Shimona, ma'am, I would like to ask you, like, what do you feel like about the impact you have created, especially on the women folk and their society and role?
Okay, so on women per se, it's I don't know. I mean, I don't have answer for that just on women, but of course, we come to know about the impact only through the mails which we get. So and not all are nice mails. Some would be like quite critical, and they would say, "What have you written? It doesn't make sense," or "How can you write this and that?" So and we take it positively. I'm sure most of us take it positively. It's a feedback where we learn. Um and impact, it's a very complicated answer because we don't come to know about the impact. There is no such documentation for the impact. But yes, when we meet people and then they say that they expect a lot from us, they would say that you people make a difference and we expect so much that you can bring change. So that starts our day, and that's inspiring. So more than the influence, more than what difference we make, I think is the expectation from the people, from the society. Also, I think that, as we were talking about COVID, these times have been very different from for all of us. And um, and uh, we've been, I think, more than just statistics, more than just figures, we've been more humane, I feel, during the COVID times, more closer to the people we are writing about. And because all of us have been impacted. So I think that, and I just wish that this kind of a humane touch continues. But I don't have a straight answer for the impact. So I'm not very sure that if this satisfies you or not.
Yeah, ma'am. So like, thank you so much for your answer for that. So I'll come back to you, Miss Viveka, ma'am. So there are many young girls and women who are planning to take up a career in healthcare or in journalism. So what is your advice for them?
Thank you, Dr. Neha. Yes, for the last 7, 8 years, I have been taking a class on healthcare journalism and environmental journalism, 15 lectures in a year at my alma mater, which is, XIC School of Journalism. And I have seen people, and it's, a lot of people kind of approach health journalism thinking it's a soft beat. And then I have to tell them that no, it's a beat where you need to learn the definitions, keep asking people to clarify doubts. It's technical in its own way. It's also one beat where probably the old rule that bad news sells, it doesn't really work, because in health journalism, you can't only give bad news, you also have to give hope to the reader out there, that yes, for instance, if you're writing a cancer story, then you're writing about the different stages of cancer, etc., etc., but you're also giving them hope. And what you're trying to build awareness in that cancer story is that go check yourself out first. If you detect your cancer early, it's treatable, it's curable, it's manageable. So you give, so you're not reporting only on the bad news, you're making that story into a story of hope rather than just a story about bad news. So that's my advice to people who are looking at this beat. I sincerely hope, and a couple of my ex students have gone on to cover the health beat. Archana Shukla is one of them, and she's now moved to a general beat of journalism in BBC News, but otherwise she was covering health very well in CNBC. So it gives me a lot of satisfaction to see people getting onto the health beat. Of course, they do a lot of other beats along with health, and I've seen a lot of students kind of like Sujata do some amount of research, do an MSc, and then come to into journalism. And when I questioned them, especially in this year's batch, when I questioned them and said that you've done an MSc, so I mean, like Sujata, probably they're planning to do to do a doc or to do a postdoc, and they said no, we want to learn how to communicate, because at the end of the day, whatever research you're doing in the lab needs to be communicated and taken out to the wider audience, which is why we're doing a course in journalism, to help us communicate better. So science communication is seeing a huge uptick in kind of, maybe because it's COVID. It last 2 years of class have been the journal that we get out in XIC at the end of the year has been on COVID. So a lot of opportunities are opening up in health journalism, in health communication, in science communication. So I'm very hopeful that the next pipeline of health journalists will be very strong on their information, be very strong in their kind of dedication to this field. It's not a default field that, okay, you entered and someone gave you a soft beat of a health thing. That's not going to happen. People are getting into journalism specifically to do healthcare journalism. They've got halfway through careers in research, and they're getting into journalism. For instance, one of my colleagues in Express Healthcare right now, Kalyani Sharma, she's a BSc. I think she's done her master's in biotechnology. She was working in a hospital on the lab side, and then she chose to get into journalism because she said, I want to write about the medicos rather than be a medico myself. So those kind of careers those kind of career shifts make me very hopeful that we are going to kind of the next line of the pipeline of healthcare journalists is kind of filling up nicely. And yes, as someone mentioned it, as Shimona mentioned, more women than men are choosing this beat, which is good because we are more empathetic, I think. And also one thing that kind of I need to caution is that yes, as a journalist, you need to present the facts, and sometimes you get too caught up in the story because we are very emotional and emotive. We then have to then we almost become activists. So when does a journalist become an activist? Is it a good thing? Is it a bad thing? And unknowingly, your biases do come out in your writing. And is that fair to the reader? And maybe in certain stories, you do need to take a stand, but can you take a stand while balancing it with facts? So you are telling your reader that this is my stand, but these are the facts. So feel free to make up your mind. So you balance your biases with the facts, as Pratibha said, that I report, I have to get the facts out there. So that's kind of how what I would tell journalists or women journalists looking into this field. It's a great field to enter, lots of scope from the career point of view, but also it's something that we need to do. And I think this is a time where health journalists are really required to cover what's happening. The world is aging. our fertility rates are dropping. I think across all countries, we are going to see a demographic which is graying, which means that our NCDs are going to increase, our lifestyle diseases are also going to increase, and now COVID has said that communicable diseases is also going to increase. So a triple whammy there. So lots of health stories, and I mean, we need people to cover those stories, not just the people in the hospital treating, but also the people in the in newsrooms making space for this beat. So sorry for the long-winded answer, but I hope, Dr. Neha, it's
Thank you, ma'am. No, no, not at all, ma'am. We are here to hear about you and your experiences today. So it's a pleasure listening to you all. So, Ms.
and Dr. Neha, I think you're doing all my panelists a great disservice by coming to me first with your questions. So please, on the next round, go to the last person first, because then I make all the points.
Sure, ma'am. Noted, ma'am. We'll do it that way. So I'll come to Ms. Sujata now. So, ma'am, with such vast experience of almost 2 decades, there have been great learnings in the journey. So there are in the industry, this industry in and out. So and it takes a lot to create an impact. So what is your advice for the youngsters who are new to the field and are looking for this field to start as a career?
Okay, I would say one, don't sensationalize any story. Give the facts as it is, and always have subject matter experts comment on it, because we are not from the medical field. We report about medical field. We need to know what the expert opinion is. That is very important. So you're reporting about COVID, but you may be hearing from many quarters that COVID can be this way, COVID can be that way, it can be infected through various factors. But get all the concerned subject matter experts to comment and get the facts right. So because our profession is to give the right information. So do justice to that. That is what I would suggest. And yes, as Viveka rightly mentioned, that healthcare is finding a place in the mainstream journalism also. Many news channels, be it NDTV or Republic or any news channels, you will find a beat on healthcare. Earlier, it was not possible. Right now, healthcare is a vast area, and whatever you do justice to it. And I would urge people to write critic articles, because always this good news article and being on the good side of the establishment and reporting on just what is right is also not a good thing. A critic article is a must for getting what is needed for the healthcare sector. That's my advice.
Thank you, ma'am. So I'll come to Ms. Rapali now. So, ma'am, a lot of people, look up to someone whom they get inspired with, to get a direction in life. So you are amongst one of them, we feel. So what is your advice to the people who are still studying and are at an early stage of their career and want to make a name for themselves in this industry and this field? What is
So
your
you
advice?
mean to say people who would want to join journalism?
Yeah.
Okay. So firstly, you have to trust yourself, be confident, persevere is the main. You have to really persevere, be determined on the path you've set out for. And as my other fellow panelists just mentioned, that you need to put out facts as they are. Go beyond the headlines. You like in our this thing, we get a whole lot of press releases. Let's say, for example, over the last 2 years, because COVID has been the focus for us, you getting press releases from companies on talking about the drugs, the clinical trials they've committed, or the vaccine companies. You have to go beyond what the company has put out as information and find out what the trials were, what were the efficacy, the efficacy of the drug or the vaccine. And because the company would only put out information which is positive. we need to go beyond what is there, read between the lines and see. And I'm not saying here to you need to, for that you need to speak to people. I mean, because we are not experts ourselves, we have to figure out, we have to speak to people, and then it's a responsibility to put out the correct picture, is what I feel, and not to sensationalize stuff. So like Viveka mentioned that, there's this thing about biases coming in and opinions. So there is again a very fine line between that. And so we are reporting, and I'm doing both. Like, I would do a news as what is happening, and also an opinion piece. So you need to see where, and get the voices there, get a balanced view out, is what I feel. And not just a particular just go with one thing which is being put out to you. So that would be the thing. And put out a fair piece, an unbiased piece, and do your research, get your ask tough questions. And I think that, and also point out, I mean, if there are let's say fault lines, gaps in, let's say, for example, the accessibility of drugs or the vaccines or shortages, it is our duty as journalists to point those out, to flag them, because otherwise nobody knows about this thing, because we I mean, the newspapers or the media has to put these out, I think. So putting out facts as they are, and then going beyond the headline or the story to work on them and put out the picture, correct picture.
Right, ma'am. Thank you.
And you would be talking about the impact, and just a little this thing, going a little this thing in terms of, for example, I'm talking just about last year, I put out a story on how, the ventilators which were all there in the country were all defunct, they were unboxed, they were lying all over the country, and there was no corrective action in terms of they were all there. And ventilators at that point was the most critical thing which was needed during the second wave. And so talking about how things were, so I put that out, and it was I was really happy. So two things happened thereafter. I mean, I'm not sure whether there was a strong correlation to that, but the satisfying thing was that maybe it was an impact, I don't know. So the PM ordered an audit of all the ventilators in the country, and asked the states to take action and get them going at that. And the most important thing, which I thought was really good, and which really gladdened my heart, was a philanthropic entity wrote to me and thanked me for the story. And then they started, repairing these ventilators. They went about in the country actually repairing them, so that, people could use them. So, we when we write, we really don't know who's reading it, what impact we have. We are actually not thinking about the impact, but somewhere someone is actually taking note of them, and probably would do something about it, is what we hope, I think.
Yeah, ma'am.
Sorry, I went a little longer than the thing. I just thought that it was an important point to share.
Yeah, no issue, ma'am. Rightly pointed out, and it's your work that creates impact, and like your voice, you are the voice of so many people in the country, and like if your voice is being heard, it does create impact all over. So I'll move to Ms. Shimona now for the next question. So, ma'am, what is the advice that you would like to give to the women folk who also want to contribute to healthcare through journalism?
So I think Viveka was very elaborate, and she took most of the points. But I would like to add that, as we all have been discussing, that we should, so there's no shortcut to success. We should understand that. And so what I've seen in the present journalist is that a lot of WhatsApp, it's happening. So you share stories based on WhatsApp, you have a common group. And so as a result, the field work, that's taken a hit. So most of the people, you will not find them on field, not going to ask questions to the people. So it's kind of a shortcut. I think that is dangerous, and that should be avoided. So that's kind of it's like herd mentality. So and second thing is, we need to read a lot. Health journalism is very demanding as far as reading is concerned. So one has to read a lot. There are a lot of medical jargons we need to understand. And always, as has been pointed, take the opinion from multiple experts. So it's kind of multi-layered thing, ask everyone and anyone in the field, related to field, and there has to be a balance. We need to strike a balance. That's very important. And listen to your heart. Eventually you have to listen to your heart, because sometimes it gets very confusing. You ask one person and the other person would contradict the statement. Ultimately you feel that there's a balance, but it's not. It's contradicting. So it's not giving the reader something what any information. So it's better that you read, you do your task, come out with questions, ask them those questions, and then after they give their opinion, they can be counter questions. It takes time. It takes a lot of time. I think it's quite extensive. It takes since it takes time, so one has to do a lot of research before writing these stories. And as I said, that reading is important. We all have the habit of reading, especially whether it is the medical journals, whether it is, so whatever beats we are covering, we need to read. And that's a very pertinent point, particularly in the health journalism. Another thing which I would like to add for those who are aspiring to, especially women. So I will not say this that only women aspire to be, because as we've discussed that it's not a soft beat anymore. Anyone can cover health, and I think everyone should be able to explore this idea of health coverage. The point is that I think that gradually, so there's a dependency on social media also. We also discussed about the fake news. We need to understand, we need to filter. There have been a lot of workshops. We had training in the Times of India group for how do we differentiate between the fake news and the the credible. So how do we make a news credible? So I think that's important. So a person should be given this kind of a training to differentiate between fake news and the authentic sources of the news. So that is what I would like to share.
Thank you, ma'am. So I'll come to you, Ms. Pratibha, now for the same question as your advice for, I would not say just for the women, I would say women as well as the young men who are want to take this as a career.
On a lighter note, I would want to say to the people who want to enter into health journalism, be it male or female, whoever it is, even though the COVID virus is flattening, we will have, as a health journalist, we'll be living with it for quite a few years now. We'll be following up with its stories. We will be looking at the variants and other variants. So we'll be following the virus. We'll be the virus news hunters for some more time. So that was on a lighter note. Keeping it very short, because most of them have, all the panelists have covered it. Fact-based approach, again, is very important. As a health journalist, we bridge the gap between be the health professionals and the common men, the doctors, and everyone. We are the catalysts. So we need to be very responsible. Don't just PubMed the information, just go to the people also and talk to them and ask the professionals what it is about. Get the facts verified, and without violating the journalist freedom of expression, balance it and do it. That's it from me.
Thank you, ma'am. So it's very inspiring to hear you all, and you guys usually interview everyone, but to have interviews done from our side is a pleasure as well as an experience, a learning experience. So we are happy to have you all here. So we have a few more questions on list. So now I'll start with you, ma'am, Ms. Simona. So this is a common question for you also. We'll go with this flow. Ms. Simona first, and maybe Ms. Rapali and Ms. Sujata and Ms. Viveka. So the question is basically, what are the principles that you follow and you will never compromise on them? So we can start with Ms. Shimona.
Okay, so I would follow the ethics. That's important for me. Ethics in reporting that would not compromise on the quality. And ethics, when I say, is if I can, be more descriptive about this. When I say ethics, it is not being biased. It's not being just one-sided because I want to promote something. There are so many things, because it's very common in any beat. People would like to suppress, people would like to use you, they often use you, and especially at a particular point of time. So and I think it's played a very important role in a very important thing in my life, and of course in medical also, there are people who influence you, they inspire you because they follow the ethics. So I think that's the key word. I would follow ethics.
Thank you, ma'am. So Ms. Pratibha.
For me, yes, ethics is very important, as Shimona has rightly spotted. And also, I'd be very careful about what I'm writing. Transparency, whatever I'm writing should be timely, and also the sources I'm quoting should be reliable, no misinformation, because it's health related article you're writing. A lot of people are reading about it and they are collecting information from you. So I would be very much giving weightage to the information I'm giving. That would be the core focus, I would say.
Thank you. Ms. Rupali.
So I think, as mentioned by Shimona, and you need to kind of present facts as they are, not bring in the biases, and not your own biases, definitely, and also be put out the be authentic, and and as be in terms of the ethical stuff. I mean, because your duty is towards the reader, your target audience, and you cannot put out misleading stuff, you cannot sensationalize stuff, and you need to put out facts as they are, I think. So I would go by these 3-4 things, and present facts as they are, authentic stuff, and do the fact checking, get into it deeper, and do a and put out the story.
Thank you. Ms. Sujata, principles that you would not compromise on.
Well, 2-3 things. One is, as Shimona said, ethics. That plays a very important role when you are reporting something as responsible as healthcare, because people go by your word, that as you keep mentioning in this forum, that you read and trust what we write, and we are not subject matter experts. So ethics and the responsibility to share the correct news and the information is upon us. So I think that is the value that I will hold on to, and um, being truthful. However difficult it may be for you to digest on a personal level, whatever is true need to be reported. That's what I would go for.
Thank you. So welcoming to you, Ms. Viveka, at last for this question. So maybe we can have your views.
Yes, all of what the other panelists have said. And also, one thing is, keeping in mind who your reader is, and keeping in mind that for a health story, that reader might well be a patient. So, who's looking for hope. So, how do you present your matter in such a way that it gives hope without hype? And how do you don't offer false hope? So when we were doing journalism, there was this whole thing that write as if you're writing for your grandmother. So here you're actually writing a healthcare story as if you're writing it for a patient, and that patient could well be a family member. It could be you, it could be a very close family member. So keep that in mind. This is not like and even though I'm saying that, even though I'm writing for a business publication, for a B2B publication, because finally at the end of the day our stuff is all out there, beyond behind, not behind a paywall, so everybody is accessing it. So unlike a beat like say pure business journalism, where people where your reader could be a stock market analyst or so, or someone tracking the steel sector, etc., etc., those are sectors which don't connect directly to life and death. Whereas your reporting, if you're reporting on the healthcare beat, connects directly to life and death. So I think that sense of responsibility is something that I wouldn't like to kind of that I hope I keep at the center of my writing whenever I sit down to write. So that's
Thank
it.
you, ma'am.
Thank you.
Yeah. Himadri, would you like to ask some more questions to the panelists?
Thank you, Neha. Yes, I have a few more questions for our panelists. So my first question is for Shimona ma'am. So ma'am, what challenges do you face while working in this field, and how do you overcome them?
I think the challenges are like, so one is, of course, there are many technical terms which one needs to understand. It's very difficult to question the doctors because they can always tweak some things, and, so it's difficult to grill them. So that's one challenge. But because as we are not subject experts, so it's difficult. So one is this. The other is that as this beat is very responsible, people look up to you, they want that, and they think that we can bring those reformations. So with that kind of an expectation, I think that's one of the biggest, I would say, that it gives sometimes sleepless nights. So it's not an easy beat to work on. Another thing would be, I think, because in medicine, nothing is 2 plus 2 is not 4. It varies, it differs. So our understanding about these things, we need to update ourselves. So a lot of reading from time to time is required. So these three things, I think, that I feel are still challenges for me.
Right. Thank you, ma'am. So my next question is for Pratibha ma'am. So ma'am, how do you handle pressure with deadlines, as at your work, it really involves like really tight deadlines. So does that create pressure on your personal life, and how do you manage this work-life balance?
Yeah, it does. There is a lot of pressure on deadlines. That is true. But you have been doing this for quite a few years now, so you it's like it's a practice. And one more thing I would like to say: the challenges, as Shimona said, getting hold of doctors is really difficult. They will say, I'm in an OT right now. I will not be able to talk to you. They will, it's their time zone. You have to attend if you want a doctor's court, if they're really busy. So that is one of the challenges. It's really difficult to get them. That is one thing. And timelines, if your pressure is there, if it's an ongoing news, suddenly something happens, because during COVID there were a lot of things which were coming up. Suddenly DGCI gives an emergency usage for one drug around 8 o'clock when you're cooking your dinner. You have to open your laptop and you have to file it. So a lot of things, because in healthcare and life sciences there's a lot of news which is breaking every now and then. You have to keep on browsing and seeing which pharma company is doing what, and whether they have launched something new, is there any new thing. So it is there, and I think that is good, right? It's part of your job. You should be happy doing it. So it's a challenge, but it's nice.
Thank you, ma'am. So my final question is for Rupali ma'am. So ma'am, how has journalism changed over the years?
Journalism has really changed from the time when I entered and now. And you know, lot of and when we started it, it was a lot of leg work, going and meeting contacts. We hardly used to get the numbers, the telephone numbers. There were no mobiles, which were very, I mean, people never shared their mobiles for one. And it was tough to get them. And let's say after 5 o'clock, when we were writing the story, the person would disappear because he would be at home and not take calls. So that was one big change which happened with the advent of technology and mobiles and all of that. Slowly, people became a little more accessible after work. If you manage to get their numbers over a period of time, when you had the contact and the source, and you've been talking to them and they become familiar, so they would kind of eventually share their numbers and whatever. So that was one change. And also, the big change was, I think, technology, because we used to depend on these we had, when we started off, we had these clippings in the library which we used to refer to, and I remember going and reading up on stuff which was there in those clippings about a particular subject, because I didn't know anything about it, and I was on the beat, so I needed to know about the companies and the sector and do all the reading, so that when I speak to that person, I would have some questions, and intelligent questions at that, and I would get some story out of him, because the main objective was getting a story, for me. And over a period of time, when you had you had computers and technology coming in, everything was available on Google, so you could just Google everything, and it's there on your laptop. So you needn't go to your newsroom library, get out the clippings, read up on that. And now what has happened is there is an overload of information. So there is too much stuff, and you need to now see what is fake and what is I mean, there are a whole lot of stuff. If you Google something, you need to then ascertain which one is correct and which one is there. So I mean, it's become a very dynamic field, ever changing. And I think COVID has made it, you're talking about challenges, COVID has made it even more challenging, because there's a whole information overload now, and we need to keep abreast with it. And technology is making it easier as well, I would say, because we would be reading up now, I mean, last 2 years, on Twitter, on all the updates globally, on vaccines, on drug companies, and would know about the drugs which are coming out, so that we can write about them. So it has changed quite a lot, I would say.
Thank you, ma'am. So I would like to thank each one of you for sharing your wonderful journey and experiences with all of us. I'm truly inspired, and I'm sure this will inspire many people to pursue their dreams. So as we are short of time, so I would quickly move to the next session. So on this International Women's Day, I would like to share two of our major initiatives that we have come up for the women. So the first one is Women in Technology. So at Health Parliament, we have been conducting various studies and research, and we found that the participation of women was very low, and it is always less than 15% of the total respondents. And we did further research, and we figured out the basic reason was basically a dearth of women leadership in healthcare and technology. So one of our founding team members, Ms. Mevish Vaishnav, ideated this initiative, that is Women in Technology program. And through this, we want to institutionalize women leadership. And that's why we are announcing this initiative before such illustrious role models who have transformed healthcare. At Health Parliament, we have also decided to sponsor 1,000 women in Health Parliament as professional members. And we hope that we'll be able to carry forward the same year-on-year basis. Also, we are offering courses on digital health and fellowships at Health Parliament at special rates to make sure that it leads to more women participation in various initiatives of Health Parliament and Digital Health Academy. And our overall intent would be that more and more women take frontal and lead roles in healthcare across the continuum of care through engaging at primary, secondary, and tertiary level of care. So our team at Health Parliament majorly comprises of women, and we hope to continue with this tradition, and we will do our bit to make sure that we increase the participation of women and inspire more women to take leadership roles. So now I would like to request Neha to share our next initiative with you all. Neha, over to you. Thank you.
Thank you, Himadri. So another initiative that we have started at Health Parliament is the development of women's health guideline. So the idea was basically conceptualized by our founder, Professor Rajendra Pratap Gupta. So we know that it is a day of celebration of women's, what all women have achieved, but we know that women, most girls in the country, from the day they are born, they face gender inequality in the country. So in one form or another. So we know that culture shapes behavior, and it is we have a culture where women put themselves last after everyone in the family, and this behavior is learned among young girls from a very young age. So if we want a world where there is gender equality, health and education need to be the two fundamental pillars that should be strengthened. So we have started this initiative of developing women's health guidelines. We know that women comprise of half of the population, and only if women are healthy, there will be healthy offsprings, healthy families, and healthy societies. So we are formulating these guidelines. So these will be first of a kind guidelines, because the approach we are following for these guidelines is life cycle. So when we are saying that we are following a life cycle approach, by that we mean that we would be covering every stage that is there in a woman's life. And another approach that we are following for these guidelines is multi-speciality. So we are reaching out to experts across the specializations, and we are taking their inputs for the same. We also have a guidelines development group dedicated for this guidelines, and through these guidelines, we will be covering all the aspects that would include the physical, mental, socio-cultural, as well as the behavioral aspects of women's health. And these guidelines are going to be for the end users, that will be the women themselves and their families. And we will have these guidelines translated into different languages for easy access and use for the women. And we will also make use of community radio stations for better outreach of these guidelines. So some of the meetings that we have already carried out till date with the experts across specializations are these. For the guideline development group, it is chaired by Professor Sunita Mittal and Dr. R.K. Srivastava. And also we have our advisor, Dr. V.M. Katoch, for this group. So some of more consultations and meetings that we have already carried out till date, these are from the top institute experts, like from AIMS, from KGMU and all, PGMI. So basically, the main aim through this guidelines is that we need to know what all issues arise in women's life and at all the stages, and what should we do early on to prevent those issues. So we have started this initiative, and we will be making these guidelines into the public domain in the coming few weeks, and finally we will release them with the hope that we know behavior changes take time, but then hoping that this would be a first step towards initiating the change. So with that, I would like to conclude today's session. So I would like to thank each one of you for joining us today for this session. Ms. Viveka, Ms. Rapali, Ms. Sujata, Ms. Pratibha, Ms. Shimona. It was wonderful having you all for this discussion. We have learned so much from you today. And we hope that we encourage and more women to take up leadership roles and come forward for a gender equal world. And we hope that to make this world a better place. So that's all from our end. Thank you so much, everyone. And also, I would like to thank each one of you that have who has joined us today for this session. It was great to have you all here. Thank you so much.